So a record number of coronavirus cases have been reported across the UK for the second day running, with over 80,000 infections confirmed yesterday.
Well, as cases soar, public confidence plummets, with many of us wondering what is coming next. The Chair of Global Public Health at Edinburgh University, Professor Devi Sridhar, joins us this morning, and also Dr. Amir Khan. They are both here to answer any questions or concerns you have. Thanks very much for all of you for getting in touch.
Professor Sridhar, doing your best to lighten the mood with the hat.
We like the festive touch. Thank you very much for that.
Keep smiling, keep going.
I mean, one of the big questions is going to be about Christmas, isn't it? And just how much people will be able to celebrate. Morning to both of you, but let's go through some of the specific points we've got from people. Vonnie1965 on Twitter says, can the Delta and Omicron variant combine to become a more dangerous form? So, Professor Sridhar, let's come to you on this one, because people are worried, aren't they, about, you know, being exposed to different things at the moment and just what the consequences could be.
So, yeah, theoretically, we could see new variants down the line that can combine some of the mutations of both of these variants. But I wouldn't tell people to be worried now. The key thing to know is that you can keep yourself safe by avoiding crowded spaces, limiting your mixing, so you just have a smaller number of close contacts, wearing masks in crowded spaces, getting vaccinated. The vaccines are really effective against severe disease, and, you know, just getting tested frequently when you're socializing and going to work and things. So there are things we can do that won't change even in the months ahead if we do see new variants evolve. OK,
Dr. Amir, one for you on fertility. Quite a few people are contacting us over this. Kim says, does the vaccine affect fertility? Very important to get clarification, as I know a lot of my daughter's friends are not having the vaccine because they're frightened that it does.
It does not affect your fertility. Now, there is a lot of misinformation about this online. The vaccines do not affect your fertility. There was some concern over this when we first started giving out the vaccines back in January, and we told women not to try and get pregnant for the first 3 months. But we've got real world data now to show that the vaccines don't affect your fertility. So childbearing age women can go forward and get the vaccines and continue to try for a baby.
We've got another one here from Amanda on Twitter. As school staff and pupils fall ill from Omicron during January, is it time to bring back bubbles and face masks in classes? Professor Sridhar, I mean, you know, a lot of people are thinking we've got the school holidays coming up, haven't we? That'll give us a bit of a break. But when we come back, are we going to have to think really carefully about how we make it work in schools because of the situation we're at?
Yeah, so I think, like in Scotland, we've kept face coverings in secondary schools to try to limit transmission in that setting. But I think the great thing is we have a vaccine that's being rolled out in other countries for 5 to 11-year-olds. 5 million kids have been vaccinated with this. And so if there are concerns about transmission in schools, we now have tools to be able to manage that and keep schools open for in-person learning. So vaccines, testing, masks, ventilation, and bubbles as well. The bubbles have their limits because you don't want to have one person who's positive in a class of 30 and then 29 kids off school for 10 days. It's quite disruptive. So there's a balance to be found there.
OK, Amir, Simon on Twitter, why are more people suffering with side effects with the booster jab than the previous 2 vaccines? Is it different?
No, it's not different. The vast majority of the booster jabs are the Pfizer vaccine, similar to what you would have had as your first and second dose if that's the vaccine you had. Side effects from the vaccine, mild ones, are very common: a sore arm, a headache, a fever. It is just your immune system responding to something foreign, attacking it, producing beautiful memory cells, neutralizing antibodies that will attack the virus in the future should you come across it. So it's not unusual to get side effects to any vaccines like this. Rest, paracetamol, fluids is the way forward.
There's an interesting one here from Anna on Twitter. Are people routinely finding out if they have Omicron after a positive PCR? Professor Sridhar, do we know this? Because obviously at the beginning, people had specific isolation requirements, didn't they, if they'd been in contact with someone with Omicron, but we don't have that now. So do people generally find out what strain they've got?
Well, not all the samples that come in are actually sequenced, and there's kind of shortcuts we use, such as S-gene dropout, to try to kind of say, oh, is that a marker for Omicron? So in a way, we're trying to estimate how much there is out there. I think with Omicron, the key thing also to know for people who are identified as being positive for this is the attack rate is really high. And this is why if you are identified and told you have Omicron, it's because we're trying to understand how many people, let's say at a party of 20, if one has Omicron, is it that 15 people get it or 18 people? And so it's that kind of studies that are being done. But at an individual level, the sequencing is not being done for every single test.
OK, Nikki on Twitter, Amir, my husband is on day 6 of isolating. I've just tested positive. Does that mean his isolation starts again as he's in the same household as me?
No, his doesn't, but Nikki's certainly does. She has to isolate for 10 days. Isolation rules are different depending on which nation you live in. If you're in England and you've got a household contact who tests positive for COVID and you're doubly vaccinated, provided you don't test positive, you can do lateral flow tests for 7 days. In Scotland, it's slightly different. If you're a household contact of someone who tests positive for COVID, you do have to self-isolate. And in Wales and Northern Ireland, different again, you do have to self-isolate, but you have to take PCR tests day 2 and day 8. But Nikki's slightly different. If she's tested positive, which she has, her isolation test time starts straight away from that positive test.
Professor Schreeder, we've got a lot of people getting in touch about vaccinations for children, how they work, what's going to be the future for this. We know that France have just approved the vaccine for children over 5 at the moment. So for all children aged 5 to 11, that's been approved. Are we likely to see that here, do you think?
I think definitely we're likely to see, right now it's with the MHRA, which approves the vaccine like a regulatory agency. I see approval hopefully by Christmas, and then JCVI hopefully gives the green light in early January, and we're looking probably at late January, early February rollout. But the larger, I think, issue now is the booster rollout's underway. We know vaccination centers are under heavy pressure to get them out to all over 18s on the timescale the Prime Minister has announced. And so again, there's an issue of, even if it is approved, are there enough people and enough centres to get the vaccine out to everyone who needs it right now?
Amir, Liz on Twitter, this is an interesting one, because I know that we hear every now and again about the advent of oral vaccines. When is there going to be an alternative for people who are genuinely needle phobic? Are we still quite away from having an orally or a nasally administered vaccine for COVID?
There are research trials going on. Oxford AstraZeneca are trialling a nasal vaccine at the moment, and there's a Texan company in Texas that is trialling a skin patch vaccine as well. However, we are a way off either one of those being approved. What I would say to people who are needle phobic, severely needle phobic, us as healthcare professionals, we are used to managing patients with all sorts of phobias, and we use distraction techniques when giving vaccine. You know, we're used to giving immunizations to children, so we know how to distract people, keep their mind on other things while we give the vaccines. And I've had patients who I've given the vaccine to who are very needle phobic. Provided you give the right distraction technique, generally the response afterwards is, well, was that it? Have I had it already? So we are trained to deal with this. So please don't put it off if you are needle phobic.
Yeah, I have to say, I don't like needles, and they were so good when they did it to me, actually. They did it really quickly. Before I even knew it, it was done.
And they gave you a lollipop as well afterwards. Just one last one, Professor Schreeder, if you may. Claire says, should gyms still be open? Can I go to my Zumba classes?
Yeah, a lot of people, because another one's saying, I have a holiday booked for New York in January. Should I go? People are worried about what they should be doing.
What are your thoughts on gyms and exercising in classes?
Yeah, we know that is a risky activity. And so if you are planning to see your loved ones and there are vulnerable members, elderly members, it's probably best to avoid gyms for right now. But to be fair to gyms, they need financial support because a voluntary lockdown is pretty harsh for them, and not having the footfall and traffic through their gyms. And on holidays, I just say right now that if you're going to see loved ones, family members, just have a look at the rules because they're constantly changing. We've just heard about France, Spain, Canada's changing rules. And so you might get stuck somewhere, let's just say, given how fast the rules are changing with the new variant.
That's a hugely important point, isn't it? Getting stuck in a country that you can't come back from. Claire, if you can't do Zumba, just follow Amir on Instagram because he does his dance classes regularly and you get more than enough exercise over the Christmas period.
Yes.
Professor Schreeder, Dr. Amir Khan, thank you for your advice this morning. Hopefully we got through plenty of questions for you guys at home.
Yeah, I think like half the country would be cheering, I have an excuse not to go to the gym, and the other half will be going, oh, no, frustrating.